There's a big difference between how New York is reporting COVID deaths versus how the federal government and many other states are reporting COVID deaths. New York is still only reporting the number of COVID deaths of people who died in hospitals and nursing homes with a confirmed laboratory test result showing that they have COVID. At the beginning of the pandemic, when we were just learning about it last March, it was a way to sort of keep the numbers pretty consistent. But at this point, a year and a half after the pandemic, a lot of other states have switched to the more broad definition that the CDC uses, which is just based on death certificate data. There's basically a difference of at least 11,000 deaths between New York's own toll and the CDC's toll. It's unclear what exactly accounts for that difference because the Department of Health, despite multiple requests from the AP, has not released a breakdown that could shed some light on how many of those deaths were people in hospices or private homes. We know in New York City, the city itself has reported that about 5,000 people died without a positive test, but they likely died of COVID-19. It's really important for states to be using sort of the same definitions of COVID deaths that take into account all death certificates in which COVID is a contributing or underlying cause, even if there wasn't a test or even if the person died in a private home or hospice as well. So at this point, it's sort of unclear what this could mean for the governor. On an individual level, people want to know how people in their community died of COVID and what the extent of outbreaks were in their communities. If they're looking at the state's website, they're getting a partial view of that. And the executive director was saying that when we're making policy decisions and we don't have the same sort of consistent data set, it can make those discussions harder. It can also fuel public distrust in governmental tallies if it seems like the CDC toll is so much higher than the New York toll. Testing was so rare at the beginning of the epidemic that the biggest issue is that even the numbers we have from death certificate data, which is what the CDC reports, that's likely going to be an undercount and not going to capture how many people died of COVID still. It's just sort of our best estimate.